Can you, Demetra? Oh, Demetra, are you here? You are on it. Can you hear me?
Yeah, I can hear you.
So
Good morning.
Good morning. So you're the first time I'm meeting you. Mia told me to reach out to you.
Okay.
Yes, Mia. You know Mia.
I do.
That's Mia. I love Mia. But she told me to reach out to you. I reached out. This is so last minute. I apologize for disrespecting your time.
It's okay.
But Geneva, she knows you. Geneva, she's coming in, and then another midwife named Mimi.
That's me.
Oh, she's talking about you? I thought you were.
Everybody calls me Mimi.
Okay, well, I apologize. The reason is I reached out to Geneva, but then I told Geneva, I was like, I don't feel comfortable. You know, I want, who she is. I want a midwife of color to join in, so we can have.
Hey, G. Good morning, Geneva.
Hey, how are you?
I'm good, babe. How are you?
I'm good. It's nice.
Are you fully dressed?
I'm dressed from here up.
Are you naked? No judgment. It's okay.
But I wear my hair in these little buns, and so when I take them out, it looks like I curled my hair.
Yeah.
I'm like, why is she so put together? It's only been up for a couple hours. We don't look like that after our birth.
I know. No, you went to a birthday?
No, I'm just like, why is she looking so foxy and fly first thing in the morning? Because I am a hot mess.
Okay, so I told Geneva, since you're Mimi, I told her to reach out to you. I said, tell her to put a head wrap on if it's that bad. But I was like, wait, don't say that. Do not say that. So the reason I was telling Geneva, I reached out to her, I talked to a registered nurse, and because of quarantine COVID-19, a lot of moms are opting for home births right now, but most of them don't even know what goes down during a home birth, and most of them have never prepared for a home birth. Personal experience, it's a whole mind thing, it's a mental thing. So that's why I brought you guys in to talk about, I guess, me and Geneva discussed more how moms who are wanting, who is Donna? Donna, you know Donna?
She's the other midwife that I told you I would ask to come on.
Okay, so I want to know more about, for moms who are considering home birthing, the realities of home birth from you guys' perspective, because you are experts. And then we could just honestly just have a flow, like an organic conversation. As you know, I am a doula, so like this is like up my alley. So I mean, just jump right in. It's super chill.
Well, I guess you have to kind of start with the individual. Home birth is a very individual decision. Would you agree with that, Geneva? So people, my big thing right now is not pimping people on their fear and really laying out all their options. Home birth is one of them, but it's not going to work for some people. It's just not. So it's up to the midwives to be very transparent as far as the commitment level and the education level, and laying out that our practices and our midwives' model of care looks completely different from an OB's. And in this past month, let me tell you, I have two statements that I make, and people either say, I'm gonna call you back, or they're like, I wanna move forward. So it's a lot more complex. It's not just straightforward, like we want home birth. It isn't for me, because I've turned people away and I've had people go, oh, is there an alternative to home birth? Yeah, there is. So I think it's important that we meet people where they are, but we don't pimp their fear.
Yeah. So just to go off what Mimi was saying, like we know that the way that the hormones work, if someone feels afraid or uncomfortable, then birth just doesn't work. And that's part of the beauty of home birth, is that for some certain people, they can feel more comfortable and they can really relax into that process more at home, particularly now when there's more fear at a hospital.
Yeah.
But if somebody is afraid of having a baby at home, that's not going to change just because of a virus. And there are certain risk factors. Like, we are not trying to have a baby die at home, or a mom who doesn't handle birth well physically because of predisposing factors. Like, we don't want to handle high risk moms. We can't handle high risk moms. And so just because there's a virus at a hospital or out in the world doesn't change our ability to serve women who may be high risk. There are other options for those women, but we just have to really look at, I'm trying to say, like, there's really a temptation as a home birth mom, like, we want to help as a home birth midwife, that we want to help every mom. And like, we can't. It's not safe for us to help every mom. And I think even like, Mimi, I know you can vouch for this, that like, when we're starting to get all these calls and we're used to having some certain level of clients every month, and then you're like, okay, how many can I actually do before I get sick? You know?
Right.
And so just really, home birth is not for everybody, and it is for more than 1% of the population.
Right. Right. And then piggybacking off of what Geneva said, there's a certain level of exposure. And when you have people that have been in your care for a while, you get to know them on a very humanistic level. You begin to know them, their children. And when you're taking late transfers, you don't really get to get that. And why that's important is my mamas have been at home for weeks.
Mm-hmm.
They have been at home for weeks. They're not going anywhere. And they make it very clear, I have not been anywhere, but my husband is working, and these are the things we're doing when he hits the door, when he walks in the garage. And that's important for us midwives, because I don't want to take anything into your home, and I don't want to take anything out.
Yeah.
It doesn't mean I'm not going to use PPE and I'm not going to use precautions, because I am. But that whole romanticizing home birth, because what's happening is people are going to Google, they're Googling home birth, then they're hopping on YouTube, and now they have this perception of what it looks like. And what I have to remind them is, okay, wait, that's a snippet. Those are little snippets put together to make this imagery look this way. Yes, it might have been beautiful, but you miss all the other stuff in between there. So now you're romanticizing this idea. If I get to have this person here and this person here, I don't feel comfortable with a house full of people right now. I'm sorry. I don't know where you've been. My kids can't even come in my house. I'm serious. I have a 19-year-old who thinks he's Wiz Khalifa. Dude, you can talk to me from the garage. He's like, well, can I get like a fist bump? Nope. Wakanda for life. I love you. Like,
Yes, Wakanda.
Like, I don't know where you've been. And he is, like kicking it with friends, under 10 people, but that's a huge risk for me. And I have asthma, so I'm really like, I'm not feeling so comfortable. I feel very vulnerable.
Yeah.
The population right now is, yes, moms are looking for alternatives. However, midwives are the most vulnerable provider group in this nation right now. If you're a CPM and a home birth midwife, not a CNM, a CPM, you can't get PPE, you can't get answers from health departments, you can't get supported in various ways simply because we are invisible. That poses a risk to us. So we really have to be careful about not saving everybody who wants a midwife and a home birth out of fear. I'm not throwing my body on the sword. Nope.
I agree with you, but so if people, because honestly, everybody ain't trying a home birth. I feel like, again, they're just like, maybe this is a possibility, but I feel like, and you guys can correct me because I am not at your level of knowledge and expertise yet, but how do you feel about people just trying to labor at home a little bit longer? And what do you recommend people do to just make that their reality? Because, some people, before this happened, the COVID-19, they were like, once I feel something, I'm going to the hospital. But, usually people go in all at 4 centimeters, I guess. But how do we feel about people trying to stay at least till like they're 6? I stay home till 8, but everybody ain't got my type of strength. I get that.
Mhm.
So like, I guess how?
Yeah, I think there's been sort of a question in people's minds of like whether or not they should hire a doula because the doula is probably not going to be able to go to the hospital with them. But I think this is a perfect time to have a doula so that you can stay home longer and that you have someone who is experienced with birth and who can say like, now might be a good time for you to go. But like, 4 hours ago, you weren't at that place yet. You were just scared. So like
Yeah.
having somebody who really understands birth with you during those first hours and can help you kind of navigate what when it would be a good time to go to the hospital to lessen that time that you're there for sure. And
I
then
support
asking
that
to be
100%.
discharged early too. Like
Oh,
there's no reason that people need to be at the hospital for 2 days after their babies are born if they're both healthy.
And if you didn't get a C-section.
Yeah.
Right, for sure.
So I think that's good. I agree with Geneva there, and that's one of my recommendations is laboring at home as long as possible. Even then, hiring a doula is still kind of rolling the dice because we need to know that those doulas haven't been dabbling in behaviors that go against,
High risk behaviors these days.
Yeah.
I'm nosy. Can you enlighten me? What they've been doing? I saw a live video today with doulas making T-shirts and badges for partners like moms, grandparents, or dads, grandparents, aunties to get them into the hospital. There's a live circling right now. I'm sure it'll hit up on your feed sometime later today.
Yeah.
But what are the risks these doulas have?
Well, the risk is, listen, I'm not gonna lie, I have a handful of doulas that I trust, and I'm leaning in right now because they ain't going nowhere. And they're coming to my home births, but they ain't been nowhere. They have not gone anywhere. I don't know that I can say that for other doulas. I know that there's this innate nature of wanting to, hop in and do things and feeling like, we can do things at a safe distance, et cetera. But I don't know that I feel comfortable with that. I'll be really honest. Like, I feel comfortable with knowing if I'm taking the extreme measures of limiting where I'm going, I'm ordering the majority of the stuff that I can get. And, I'm really just staying at home because it isn't just about me. I have all these families I have to worry about. I would want any doula that's working with me or a family that I refer to be doing the same thing. So I think that's important is, that risky behavior. Like, are y'all going and looking for succulents on a Saturday because the sun is out? Like,
Good
really?
and tired by. Right. How are you being safe? Right.
Right. And I think that's really important. And I'm not passing judgment, but this is one of those times where we need all birth workers to recognize it isn't just about what you bring to the table. It's about what you can leave behind, literally, in somebody's home.
Wow.
And so I am a little skeptical about which doulas are doing that because I don't know them on that level. So yeah.
That's the same protocol pregnant mommies need to take as well. I mean, there is not really a way you can tell if somebody's been roaming these streets. But that I didn't even think about that. What are you bringing into my home? But I have seen people being virtual doulas. I feel like people are pushing that. But my question to you guys: do you think that's effective, or is it depending on the person?
It depends on the person. I mean, like for me personally, if somebody has a doula that they can trust that can labor with them at home, and the doula is not taking on that scope of I've been doing birth for 2 millennials and taking on some added risk, that's cool. If they're not comfortable with doing that and wanting to do something virtual, I think that's good. I also worry though about the complication of the partner or husband. What does that look like for that individual having to be like focused on the phone or a laptop or something like that, I don't want that person to be distracted. I want that partner or husband to be very present in that moment. So, I'm torn. If it works for somebody, great. If it doesn't, what do you do?
Yeah. So I also work not only as a home birth midwife, but also as a doula trainer. And what I try to teach my doulas all the time is that they aren't the hero of the story, right? Like,
Right.
our job is to empower these birthing people to be the hero of their own story. And so I feel like that's actually, this virus is helping doulas figure that out a little bit more, that like their job isn't to save this mom from her birth, that like she can do it. It doesn't matter if a doula is there or not. Like, I feel like this is empowering moms even on a whole different level to find their own inner strength and to rely on that power that is within themselves that they've always had. And at the end of the story, they're not like, oh, my doula was so great. They're like, I was great. Like, I did this. And that's, I think, what we see at home births too, because most midwives aren't super hands-on and like, let me fix this for you. We're like, yep, you've got this. You're doing this. Like, how amazing are you right now? Keep going.
Yeah.
True. That is very true. I guess, I don't know. Honestly, if I were pregnant right now, I'm not gonna front. I would be worried. Because it's really just, what does my birth story look like now? And I mean, everybody has their birth plan. I guess that's a good question. Like, how do you think people should do their birth plans now that there's like the quarantine? Like, do you think birth plans are more important even now, or do we just go with whatever the hospital gives us and just be happy that our baby's here?
Nope. I still recommend a birth plan. As a home birth midwife, my clients are required to pre-register at the hospital. They're required to pack a bag, and they're required to do a birth plan, because home birth is not a guarantee.
That is so real.
It is not a guarantee. It is a plan, and we may have to change our venue and go to the hospital. So 36 weeks, you have to have all 3 of those things done. And as far as the birth plan goes, I don't recommend that they change it. I recommend that we're very realistic with the birth plan. I like for my clients to use the template from, the bump.com, because it literally is like 8 pages of questions, which they never think of because they have not, they're focused on home birth, which is great. But I also have to remind them, at any point, I could say we are not safe when we are leaving. This is the last thing we want to be doing, entering that facility. I think the birth plan is, if not, it is more important now than it was 2 months ago.
Wow.
Yeah, I agree.
Super important.
And just the level of education that they need to have, because there are doctors who are like, oh, we just need to induce everybody. And
hello. That's what I'm worried about.
Yeah, the C-section rate, Penny and I work with Nurse Family Partnership, and since this has happened, the C-section rate, I don't know, in a week, Nurse Family Partnership had like 26 births and 17 of them were C-sections. And like, they're just trying to move people through, like everybody's scared. So how can we try to control this in some way, And so C-section is one way that they're trying to control it. Induction is a way that they're trying to control it. And, switching to home birth is a way that people are trying to control it. And so everybody's trying in whatever way they can to figure out how this looks. Like you said, in their own birth story now, we don't know. And people are afraid. And so I think like educating yourself and sitting with yourself, like finding that calm center, connecting with your baby, and like coming back to who we really are as women, as humans. And can we give birth at home? What do we really need to have a baby? And answering those honestly for yourself, whether that, no matter where that's at.
The honesty piece. I have found that the few moms that I have taken into care are pretty honest. I'm the dads, the partners, right? I have a couple that are super scared, and I have constantly come back to that fear that your partner or your husband has shows up at your birth. And when it shows up at your birth, it shows up in a place and space where you're extremely vulnerable. It shows up in a place and space where you're more in tune to what he or they are thinking than what's going on with your body. That poses problems. And it's not something that you can remedy in that moment. You might have a dysfunctional labor pattern, and extended labor that lasts forever and ever and ever. You know, so just, being honest as a midwife, but also the clients need to be very transparent with themselves, with each other, and be very honest.
Yes. This is a time to be honest. This is not time to play around. Oh my God, this is so good. Okay, is there anything besides quarantine, if the quarantine did not happen and we weren't all social distancing, I feel like, is there anything that I guess issues that you guys deal with as a home birth midwife in your community that needs to be discussed? I know me and Geneva had a quick discussion about the affordability of home birth and why that's still an issue, which honestly, home birth is way cheaper than the hospital birth. I mean, everybody says that. I told Geneva I paid $2,500 under the table for my home birth, and so I didn't walk away with a bill. Like, nobody owned my baby when that's the way I looked at it. And then before that, I went to a birth center, and it's crazy how even still in 2020 that it's still not as affordable as it is. We're really not being, I don't know, like, people aren't supporting it like the private insurance companies. I mean, you guys tell me, I'm not that familiar.
That's true. That's truth, Colin, right there. It's not supported. And unfortunately, Medicaid, it doesn't pay CPMs. So these people are, using their tax returns, they're hustling, and it's a double-edged sword, because I can hustle up supplies to get these OB kits so that we can do intermittent monitoring at home. Like, I can side hustle and do what I got to do to seek resources for that. But and when an individual comes and they don't have the finances, in this time, it really brings light to home birth is a privilege.
Hello.
It is a privilege, number one.
I want to touch on that too. After you say that, I want to continue that conversation. Go ahead.
It's a privilege. But then number two, the midwife needs to be compensated. And people just do not get that. Like, you wouldn't go to the OB and be like, catch me outside. You wouldn't do that. You wouldn't do that. But you'll do that to a midwife in a New York minute. And it devalues our work. I charge $1,500 for my Medicaid clients, $3,200 for commercial. You don't get half of me because you're paying half the fee. You get all of me, all of this, all of this, all of this. Okay, you get nothing.
Did you point to your heart too?
I did.
Okay, I didn't see that.
Yeah.
That's important.
Yeah, because you show up and you give so much of yourself.
Yes, you do.
When you show up as a midwife, you give so much of yourself. And the currency isn't just monetary. And people don't recognize that. Especially now, when you pull me out of my home, or you pull Geneva out of her home, or you pull Donna out of her home, the currency is our life.
Yeah.
With this virus, number one. Number two, the currency is you pull us away from our children and our families. We can't get that back. So when we're asking to be paid, that should not be something that needs to be negotiated back and forth. People will say, a couple people that have asked me about coming into care, like, well, do I still have to pay the full $1,500? First of all, don't insult me.
Yeah, that is nothing. $1,500.
It is nothing. Don't insult me, okay? Because that currency is not worth what I'm bringing to you and what I'm using, right? So with this virus, you're really beginning to see the separation, the gap, right? That trickle down of these people aren't working anymore, so they can't pay their midwife.
Right.
What do you do with those individuals? Do you walk away or do you still commit to them? And as midwives, most of us will still commit to it and try to work it out, because this virus is nobody's fault.
It's an act of God. That's
right. Right. So the powers that be need to recognize this.
Mm-hmm.
They need to recognize that there are constituents within this state that are still being cared for, and that the individual who's caring for them is getting less of a compensation.
But I feel like y'all are in need way more. There has to be a surge in y'all phone ringing right now, because
it doesn't stop ringing.
That's what I'm saying, and you should be paid accordingly. But everyone's starting to see, if anything, for me, I know they're seeing the midwife's value to the economy and a doula's value, because let's be honest, these hospitals probably do not have enough beds in the labor and delivery for these mommies. And so if they can keep the mommies at home where everybody's staying at home anyway, it's a win-win. So I don't understand at this point, why isn't there funding, or the funding you guys need to help support these moms? Because
most of the people in power don't know we exist.
Yeah.
And they don't know the difference between doula and midwife. Go ahead.
That's true.
I think that's the number one thing that people can do who care about birth right now is call their insurance company, call their legislators. Medicaid should know that we exist, should cover us. Whether or not they're interested in a home birth, they should call their insurance and tell their insurance that home birth is an option and that it should be covered. They're, as an in-network exception, I have clients right now trying to get in-network exceptions, and some of the insurance companies are saying, well, home birth isn't a medical necessity, but right now you can argue that it is. And so,
especially this going on, it is.
Yeah. And so it should be an option, and it should not just be, like Mimi said, something that you can do if you can afford it. Like every person who wants to have a home birth should have that option.
Yeah.
And it shouldn't come down to me or Mimi being like, well, am I going to do this birth for free? Because we do ask ourselves that, like, is this someone who I feel strongly enough about that I'm going to do this birth for free?
I'm curious to get up in your business. How many births have you guys done for free? Pro bono. How many? This makes you look good.
I committed to doing 2 to 3 pro bono a year, and I've done that since 2015.
Wow, that's a lot.
It is.
I want people to understand, midwives, we're not talking they just show up, hey, baby's here. No, this is including, I'm assuming, correct me, all prenatal visits too.
Yeah, and postnatal visits, and that's the hardest part is the postpartum, because we don't just send them away and be like, see you in 6 weeks, hope everything goes okay. We're talking to these people every day. We're at their house every other day.
9+ months sometimes.
Like, or now doing telehealth sometimes, but like, we're truly committed to their health afterwards. For me, that's the most important part. And I just had somebody yesterday call me and ask if I would just show up for her birth and not do prenatal or postnatal care. And I was like, no, I can't show up as an authentic midwife. I can't care for you in that way, because it goes against everything I believe in.
And so it's a risk.
There's no way I'm just going to show up at your birth.
Right.
That's a huge, from experience, that's a huge risk. I don't know how you're eating. I don't know how you're feeling. I don't know what your numbers look like on your monthly test. I would say no.
I said no.
Yeah.
I was you can pay less money and I'll still help you, but I can't I'm not going to show up at your birth and nothing else, like, no matter how much you pay me.
Right. And I have had people call, even before the virus, that are in labor, that have gone to the hospital, been sent home, that have been afraid, that have been mistreated. And my goal at that point is not to show up as a midwife. My goal at that point is to show up and get them to the hospital.
Okay, so that, I'm glad you said that, mistreated. I don't know if you guys know this, but I'm big on the maternal mortality rates of African American women. So this is, I guess, clearly opinion, but we all know that we have the highest rates. African American women have the highest rates. My friend of May 2019 passed away. She was 6 months pregnant. So this is like something I'm very passionate about. Do you think African American women, as of now, because of COVID-19, are like, those numbers are going to increase even more? I mean, that's hard to even say, but do you think we'll probably be mistreated even more and not listened to because of COVID-19?
I don't know if it would be, only time will tell. But what my lived experience with people tells me is that, and statistics and evidence supports it, is that Black women are not listened to. They're not believed. And that in itself is dangerous. Mm-hmm. So now that you have this complication of this virus, mm-hmm. it adds a new level of worry and concern. There are providers and nurses that do genuinely care. They understand the risk associated with people of color or the LGBTQIA community. They get it, and they genuinely show up and care and listen. But you still have those who do not. So, you know, time will tell, but that is a fact. And people are not going to change how they assess people based off of this new circumstance, right? If anything, they're going to continue what they have always done, but it might be exacerbated. We might see them doing it more than they did previously.
Mm-hmm. That's what I'm worried about. Because I have a mommy friend that's currently pregnant with her third, and she was seeking approval for a VBAC because she felt like she was wrongly diagnosed for the 2 C-sections she had prior, she was taken advantage of. And because she's an African-American woman and she wants a VBAC, we all have this feeling like they're not going to honor that because of what's going on in the hospitals.
And that goes back to the birth plan, okay? It goes back to the birth plan. When I put that into my client's chart, it becomes part of their chart. Their chart is what? A legal document. That's what their chart is. It's a legal document.
That is
right?
True. That's absolutely right.
It goes back to what Geneva said about the education, right? Because as the midwife's model of care believes in all the principles of ethical practice. So the right to choice, right? But what I'm learning with all of this exposure and conversations that I'm having is people know that they have the right to choose, but they don't know what that is. They don't know what their choices are. They don't have that knowledge. And so at the beginning of pregnancy, typically people don't have that, and they learn that with us over time. So when you've got people who are running from the hospital and looking for alternatives, they still don't know what that means and what that looks like. They still don't understand their rights and responsibilities as a birthing person in a hospital setting. Just because we have a virus doesn't mean you can't, or your partner or your husband cannot lay down those birth rights. You have them. Whether or not it's comfortable for the hospital, not your issue.
Okay, yes. 2 snaps. That was good.
Not your issue.
People needed to hear that. So is there anything else?
Yeah, I think that we'll be seeing, my experience with women of color in the hospital is that, honestly, like I see them be lied to, and I see that because whether you're a birthing person or whether you're a provider, people are working from a space of fear right now, and that makes us do things that we may or may not normally do, and whether that's making a decision or whether that's telling somebody why they should do what you want them to do. I feel like Mimi said, like people, and especially women of color, just really need to know what their options are. They need to truly understand why things are done and whether that's something that applies to them or not. And so to truly understand their own bodies as well as their options.
Mm-hmm.
The hard part, though, the reality, Geneva, is we always say, we need to educate ourselves, but sometimes we're not even offered the resources. We don't even know where to go. And so, like, even Demetra being a Black midwife, have we even reached the thousands of Black midwives here in America? Do you get what I'm saying? So our resources, even though we need to educate, our resources are kind of still limited because those resources aren't going into the neighborhoods where they have where they're having the babies. You get what I'm saying? So
yeah, I get that.
And back to what she said was a privilege, it is a privilege to have a home birth. I was a part of a community where these resources were given to me because of my zip code. Oftentimes, depending on your zip code, you don't have these resources. And you don't even know they exist. You just go by what your grandma and your auntie tell you. And some of that stuff is like old wives telling anyway.
Well, and it's important because right now we are so heavily dependent on information from social media. And I'm I am very transparent. Sometimes my mouth gets me in trouble.
It's okay.
And this may be a very unpopular opinion, so let me just put this disclaimer out there before I open my mouth.
Okay, we heard it. Go ahead, girl. Say it.
I will call bullshit on that. Because
on what?
On resources, because we're not just talking like facility, access to a midwife. All day long, I see stuff on social media from pregnant women, Black women, people of color, and I'm like, where are you getting this information from, y'all? And they share it, and everybody starts, gapping in like, girl, did you see this? And it's like, whoa. There is an opportunity like never before for communities of color to share resources as far as education over the internet that you don't have to go and show up for. You know what I'm saying? Like, for example, I went over the 10 birthrights at the Black Women's March in December. Like, there's a 7-minute speech of me saying, you have the right for this, you have the right for that, you have the right for this, you have the right for that. You have resources on almost every Black Midwife's page where you can go, like, here's your resource for your county. Here, you can go here nationally. So I feel like as a people, we have to take some ounce. Okay. We have to own our lack of wanting truth and evidence-based truth. And I understand that some of it is over your head. I get that. But we're in a place and space where it is easily accessible, regardless if you have a person of color to come beside you and walk with you. True. You have that ability to share that information. Like I think there is a group like the Black Moms Birthing Connect, whatever. Like I drop that, information over birthrights. We do it a couple times a year. Like, it's here. But then to see so many people be, come back and be like, well, no, I didn't do that. I did this instead. We can't help that.
Well, if they say that, at that point it's choice. It's not because you didn't know.
Exactly.
Because you were given.
Exactly. Exactly. I'll give you an example. A person, a while back, this person, every time I said do this, they do that, and do this and do that. And then they wonder why their outcome is different. Listen, you have to take ownership. I don't believe in fear-based pregnancy, birth, or labor. I don't believe in that. What I do believe in is your ability to gather information to keep you safe. And it doesn't matter if it's just birth. I mean, I'll be honest, I had 2 surgeries last year. In my last surgery, when I came out of anesthesia, let me tell you, it went down. As loopy as I was under all of the narcotics, my husband walked in and was like, what is going on? I literally told the nurse, get away from me. I know what you're doing. I know what you're doing. And you're assuming that I'm not in as much pain because that's what you've been taught. Mm-hmm. So what you gonna do is you're gonna get away from me and you're gonna go get me a representative. Oh, all of a sudden things change.
When you speak up for yourself.
When you speak up for yourself and you know that you have the right to say, oh, no, not today, Linda. Go sit down, Karen. You're not going to treat me this way. So when we talk about ethical practice, unfortunately, we as birthing people have to understand that, yes, I have the right to autonomy. I have the right to choice. But that medical professional has an ethical responsibility not to cause me any harm. So if you're sitting here telling me something out of fear, you're trying to invoke fear in me to make me do something that is convenient for you. They took an oath. and they're violating that oath. That person has a responsibility to do good, cause no harm, and to do good unto you. And they have a responsibility of justice. And birth is a huge justice issue because we see obstetrical violence on a day-to-day, case-to-case basis, right? So it's important for people of color in our, the LGBTQIA community to really look for those organizations and get those resources. Listen to the videos, listen to the experts, not your homegirl. We love our Black aunties.
We love them.
We love grandma, right? We love them. And there is some truth telling behind it. Like, it took 5 children for me to unpeel and unpack everything my grandmother told me. Some of it, she was spot on. Others, okay, grandma. Okay, grandma. 5 babies later, and I'm like, even at 16, I thought that was shady, and I was right.
That is so rich. This is good. Oh man.
Yeah, and I think that goes back to like honoring your inner truth. I do believe that women have an inner knowledge within themselves that they can give birth and that their body was designed to do this. And you don't have to, of course we hear from our families and epigenetics and all of these things affect our experience, but what does your inner truth tell you? Can you come back to that?
And one thing that people have to understand, and I love that Geneva said that, one of my core principles in my practice is if a mom says something to me like off the wall, that's just not a typical comment, or a mother is saying to me like, this doesn't feel right, I'm not gonna be like, okay, you're doing so great, just breathe. No, my spidey intuition says, okay, between the next contraction, I'm gonna need you to help me understand what that is. And most of the times, there's fun and we shouldn't be at home. That intuition is given to us. It is given to us for a reason. It's given to us to keep our babies safe and to keep our babies alive.
Hello, I agree.
Listen to it. Believe it. Trust it.
And find a care provider who believes you too.
And that's it. All right, guys. If I don't stop us now, I won't be able to sleep and my computer will shut off and I have nothing. But I want to tell you, I am truly honored. I feel like I'm on video with greatness right now. I appreciate you. I've never met Demetra in person, but I feel like this is just as good. Geneva, thank you. Thank you. Like, you guys are gems to our birthing community. I value you, and hopefully I can get pregnant. Y'all need to send the pregnant people guides to come touch my belly and wish a baby up in me. So I'm not even playing. And I know who to call when I want a home birth, my 3rd home birth. I know I have to fly.
Right on.
Yes.
Right on.
Yes. All right, guys.
Thank you, Candace.
Thank you.
You're welcome.
My cell number. You guys have a wonderful Sunday.
You too. See you later, Geneva. Thanks for
Bye.
everything.
Talk to you soon.
Alrighty. Bye-bye.